to be co-moderating this session with my colleague Edith from Zambia. It is also my greatest honor to introduce Professor Senait as well. Professor Senait Fisseha is a globally recognized leader in reproductive health and rights and a lifelong gender champion. She currently serves as the Director of Global Programs at the Susan Thompson Buffett Foundation and the Chief Advisor to the Director General of the World Health Organization. She is a medical doctor and a specialist in human rights law by training, and has held a multitude of leadership roles in clinical settings, including co-directing the Michigan University Medical School's Path of Excellence in Global Health and Disparities. She was born in Ethiopia and now resides in Rwanda. And we could not be more delighted to have her share her experiences in journey with us today, as well as her insights on the future of global health leadership. Everyone, please join me in welcoming Professor Senait. We are delighted to have you joining us today in this conversation. Just to kickstart the conversation, Professor Senait, I've just shared about your amazing work in global health field and what you're doing now to address global health inequities and make progress in the field of sexual and reproductive health. Everyone on this call is a Global Health Core Fellow, alum, or staff member, which means that we are committed to our leadership, development in global health, and interested in how leaders can make progress in the sector. So the one thing that we often discuss in the program, and that is in Global Health Core program, is the inner work of leadership and our purpose in the work. With that said, we would like to start this conversation by learning from your journey. So please share with us your personal journey and the purpose in advancing global health.
Thank you, Hannah. Thank you, Precious and Edith, for co-hosting. Really grateful to Global Health Core for inviting me. I really want to share how excited I am to be here. One of the things that inspires me the most is being around young people, particularly young people from the Sub-Saharan Africa region and other developing countries. I'm grateful that you find my journey interesting and inspiring, and I'm happy to share it. As you mentioned, I was born and raised in Ethiopia. What that means is, like many people that grow up in the global South, it is growing up witnessing many young girls and women who lack the opportunity, whether it is opportunity to go to school or opportunity to control their own bodies. So those were my early experiences that has shaped me. I'm also unique in a sense that I, grew up in the 70s and 80s, and in Ethiopia, it was a family, especially a father, who really was committed to his daughters. And in a culture where patriarchy and misogyny are so pervasive, I was brought up by a father who was unapologetically feminist and who really prioritized education for his children and did not treat his daughters different from his sons. If anything, he saw the value of investing in girls. And this has encouraged me to really become a very outspoken person growing up in a culture that did not tolerate girls being very loud and being strong. But I have carried that on to be an outspoken advocate for women's rights and equity, starting from a very, very early age. I was very determined, given the path I had traveled. I was very determined to make change for young people who lacked some of the opportunities and privilege I had. And now my goal from where I am now is really to ensure I am not the only woman, I am not the only minority or the person of African descent in the room making decisions and allocating funds.
Thank you so much, Professor Senait. That is very inspiring to hear that your father is one of your greatest inspiration in the work that you're doing. Edith.
Thank you so much for that rich insight, Precious and Professor Senait. And I'm really inspired already. just for the fact that you mentioned that you draw your motivation from seeing other women, and you've grown up in an environment where there's so many women that lack, opportunities. And so, as you may be aware, one of the principles of Global Health Corps is to bring together young professionals and train them and invest in their leadership. And so I believe leaders have a huge role to play in bridging some of the gaps in global health systems. And so what would you say are some of the guiding principles global health leaders need to live by to realize health equity? And just to add to that question, how do you ensure that you're actually able to continue growing and developing as a leader in these areas?
Thank you. That is a loaded question, Edith. And much like me, both you and Precious, right? Working in the global South, working in organizations that are really working hard to do good, but also are, global North organization, PSI and POP Council are all, our partner organizations that we do a lot of work with. But if you look at global health in general, it's really entrenched in decades of colonialism, racism, sexism, right? Like all the isms that you can think of that has led to the situation we're experiencing now. We have seen, inhumane restrictions, for example, on women's bodies and their rights when it comes to sexual and reproductive health and rights. And as a result of that, we see stark differences in health outcomes between, for example, white people and Black or Indigenous and Latino population in the US. You look at a vaccination rollout, for example, that has left 80% of the world behind. So, when you look at, what are the global principles for global health leaders, we really need to focus, leaders need to focus on undoing this decades of harm to realize health equity. And to remember that human rights, no matter what you do, are the center of our work. So I often ask myself the guiding question, how are my actions advancing equity? If that answer is clear, I move forward. And I think that really should be the question that every global health leader, all of us in the room, right, should ask ourselves.
Wow, thank you so much. I think that's quite interesting. So I'm trying as much as possible to take note of, all the rich discussions that we're having here. And I love your last point where you've indicated that it's a question tossed back to us as global health leaders to say, how are my actions advancing health equity, which is quite interesting because for me, it brings me back to the aspect of preparation as a leader. So I believe preparation for young leaders is everything. So thank you very much for that response. Over to you, Precious.
Thank you so much, Edith and Professor Senait, for that very insightful response. As an advocate and a young leader, I am personally inspired and driven by one of your invaluable pieces of advice, Professor Senait, that we need to be comfortable with making people uncomfortable and be bold in disrupting the status quo for the desired change to take shape. Continuously reflect on this piece of advice that you shared some time back. But this also brings us to our next point of discussion and a point of interest for most of us, which is advocacy in sexual and reproductive health. Also to mention, it's a significant part of my role, and Edith and I will be taking part in an advocacy training starting next week, which I learned next week is actually May, so we'll be a part of that program. But we understand the importance of advocating for sexual and reproductive health and rights of individuals across communities, and this has been a significant part of your work, and advocacy is pretty much something that you've been doing throughout your career. You noted in one of the interviews that you did in Lancet on empowering the women through reproductive health, and that you mentioned that one of your guiding principles is the belief that we cannot accept the status school. This brings me to the next question, Professor Senait. Please share with us a little bit more about what led you to build your career around sexual and reproductive health advocacy and health equity.
Thank you, Precious. You know, we are a reflection of our experiences, and of the start, you know, being born and raised in Ethiopia, I think pretty much has shaped a lot of my work. But frankly, it wasn't defined only by that. You know, I had clarity that I wanted to dedicate my time, you know, the rest of my life working in women's health and women's rights very, very early on. But if I could share some of the experiences, for example, that shaped me, you know, while in undergrad, for example, I went to Michigan. You know, I was in a school in Chicago, and I had a summer opportunity to do research in Michigan, in Detroit. And you know, when I moved from the U.S. from Ethiopia to the U.S., I mean, there was just a vast, you know, overwhelming abundance of food, right? So here I am, quite impressed with the United States, and I traveled to Detroit for summer research, and I go to the nearest grocery store, which was a significant distance from where I resided. And I literally walk into the grocery store to see very barren, empty shelves with many things that had value locked behind a shelf, and frankly, a food desert, right? So I'm saying to myself, this cannot be America, right? This is not the America I had gotten to experience for the first few years. And then, you know, going to grad school in the Midwest, you know, in Southern Illinois, where there was one gynecologist covering the southern 13 counties and with high rates of maternal mortalities, you know, sort of these experiences have helped me realize that, you know, inequities exist all around us. So these are really the early experiences that are sort of led me to get for example, you know, the other thing that was really stark when I was in my formative years was, you know, the Clintons running for office and talking about medical malpractice and the direct impact of medical malpractice on OBGYNs, and really limiting, and the impact was mostly felt in inner cities, you know, and rural areas where women and girls cannot access quality care. So, you know, these things led me to get, you know, I was on a path to get an MD PhD in cancer research, but I flipped and decided to do an MD JD, going to medical school and law school, and sort of focus my time understanding work through human rights and justice work. When I was in medical school, I traveled, for example, to India, where I had, you know, firsthand experience of, you know, racism and power dynamic early on, very, very early on in the field. You know, we had traveled with a group of myself, a close friend from India, and just a lot of the dean and professors, a lot of, you know, white people, and we had an incredible experience until they left, and my friend and I were left, and all of a sudden, you know, both, you know, young women of color and doors that were open started to shut up, you know, to shut on us. So for me, it really very early on, I was able to see how the issue that I cared about, which was bodily autonomy growing up, is closely interlinked to justice, and that these experiences, you know, have made me to be a very fierce champion to fight for things that are, that I think are basic rights, right? You know, sexual reproductive rights, the ability for a woman to control her body. Whenever folks talk about, you know, the control of women, their property or work or access to this and that, I can't understand how one control, you know, something else if you cannot control your own body. So those are the things that have shaped me from very, very early on to be a staunch supporter of women's ability to control their body, particularly through accessing safe abortion and having a family by choice and not chance.
Thank you, Professor Senait. I share I feel like as you speak and as you shared, we have some common sources of inspiration, and it's exciting to know that you drew your drive from a point when you were young young woman, just like myself, it kind of poses a challenge to me as well in driving change, in seeing what exactly I can impact through my career. Edith, your thoughts?
Oh, interesting. I think just like Precious has indicated, there's so much that you've shared already, and I think I can relate. I love the fact that you've indicated that your experiences have, shaped you and have motivated you to actually made you realize that inequalities do exist. So speaking of inequalities, my next question really is around having to realize that sexual and reproductive health in the past years, I think has really, we have seen challenges in sexual reproductive health. And we've seen that with the onset of COVID-19 and the response least prioritized sexual and reproductive health and rights. So one would actually, argue that we've been sitting on a time bomb all this while, and COVID-19 merely revealed the system gaps or some of the challenges that we have in our health systems. And in one of your discussions in the Women's Leadership in Global Health Conference, you did highlight that the inequalities have actually been in existence for a very long time, and even long before the pandemic. And so my question really is, in your view, what have been the trends for women's health and sexual reproductive health over the years? And this is like a 3-in-1 sort of question. And so really, we just want to know what your views are with regards to the trends for women's health and sexual reproductive health over the years, and what are some of the key underlying challenges or issues that should be addressed. And just one last one around this is, what is it that young leaders can do to accelerate progress in sexual reproductive health?
Thank you, Edith. I think you're absolutely right. I mean, the COVID-19 pandemic did not create inequalities. It just shone light on existing inequalities. But we also, especially if you ask about the trends over time, we've also seen enormous progress. And that progress is a result of the persistence and resilience of women themselves, women as political leaders, women as organizers, activists, and abortion providers. And it's often up to people, in overlooked groups, frankly, to raise their voices and drive change. But we have seen positive trends. I mean, there have been flourishing reproductive justice movements, across the world, that has started by a group of Black women in the United States several decades ago. And this demands and calls to action have now taken roots. We've seen growing grassroots movements of young people and women to legalize abortion across the world, countries with very active on-the-ground movements in the past year, including countries like Namibia in Africa, Thailand in Asia, and Argentina, have all yielded, fruit, or at least have given us hope that change is possible. There is, in terms of shift, how COVID-19, as you rightly said, has both shown the light but also exacerbated, right, the systems of oppression, that women face both on their rights and their bodies. Sexual and reproductive health care are often the first to go during an emergency. They are deemed not essential in many, many places. So even if we've made significant progress over the last 2 decades in legalizing abortion in many parts of the world, in countries and leaders committing to advancing family planning, adolescent sexual health, comprehensive sexuality education, we are also now, with this pandemic, seeing the services going away. And when you combine that with the spike in gender-based violence, with school closures resulting in a spike in teen pregnancy, or an increase in unintended pregnancy, early marriage, unsafe abortion, we know that we are going to be in tough, we're going to have tough times ahead. There was a recent United Nations report, for example, that only half of women in under-resourced countries are able to make decisions over their own bodies. So, every person should have the right, that basic right to make decision about their own body. So yes, there has been progress, but COVID is stalling that progress. It is shining light on the inequalities. And what that means is there is a lot of work to be done. And frankly, it is people like you and Edith, and then the folks in this room who are really rooted in communities and who are committed not just to advance things for themselves, but their communities, who are going to help us achieve more progress.
Oh, thank you so much, Professor Senait. And indeed, COVID has really worsened some of the underlying challenges and has also revealed some of the gaps in, the health system. Precious, your thoughts on that?
Thank you so much, Edith and Professor Senait. It's good that you mentioned that the health system inequalities and iniquities were exposed during the COVID-19 pandemic. We saw that firsthand in Uganda, where maternal and child health services, sexual and reproductive health services were really deprioritized. And it took raising voices and speaking out boldly and taking deliberate actions to come up with guidelines and engage the ministries and retable the issues and let them know that this is actually an essential service, so that needs to be reconsidered. And that brings us to also speaking more broadly about the health systems, moving a little bit away from sexual reproductive health, but broadly the health system, because now we see that the systems were already broken anyway. You gave a commencement speech at the University of Global Health Equity in Rwanda last year, a year that we all know was characterized by drastic and extreme changes across all spheres of life. You noted that we are not only living through a global pandemic, but a greater revolution of sorts. You added that a series of upheavals that have forced us to take much harder look at the institutions and the systems around us and to demand for so much better. So looking at the health system in general, in your view, how is the field of global health shifting after 2020? And what role should young leaders like myself, like every other young leader in this room, play in global health to strengthen health systems in the new post-COVID-19 world?
Thank you, Precious, and thank you also for pulling from some of the comments I've provided in the past. I really want to start that question by applauding, the people in this virtual room, including you and Edith, for really wanting to do good and for persevering in this very difficult time. It is really an intense time in global health to start a career in this field. But responding to your questions, what are some of the post-COVID shifts that we're seeing? I think we are seeing a lot of positive things. I think from the start, we've seen very effective actions of women leaders during this pandemic. If you see the countries that managed COVID, right, from New Zealand to Germany to Iceland, many of these countries from South Korea are led by women. So I think that is a lot, to celebrate. We've also seen unprecedented progress, especially in advancing sexual and reproductive health using telemedicine. Women who, are unable to go to facilities oftentimes are now able to access medication abortion, contraception, using their telephones, using telemedicine. And I hope that is something that will persist post-COVID. The other exciting thing for me, frankly, has been, as challenging as it has been, the travel restrictions, it has really limited sort of the fly-in, meetings in Africa and Asia and other parts of the world. And what that has done, it has given people, especially young people on the ground, more space to lead. The virtual meeting rooms also, frankly, have created an opportunity for an inclusive leadership, right? Oftentimes, people from the Global South don't have the resources or are not invited to show up at a lot of global meetings. And I think the pandemic and therefore the inability now to travel has allowed for all of us to, so it has democratized participation in meetings. It has given a lot of young people voices. And I hope these are some gains that we're able to maintain. But at the same time, we're witnessing one of the most inequitable vaccine rollouts in history. For where my home in the United States, where I have resided for the last 30 years, and in other rich countries, 1 in 4, high-income countries have received a COVID vaccine. But if you look at the developing world, which is a world that was mostly colonized in the past, it is about 1 in more than 500 that have access to these vaccines. So, if you look at Africa right now, all the predictions seem to suggest that it's going to be 2023 before Africa vaccinates its population, right? If you look at the COVAX rollout, we have received less than 0.2% of the vaccines, of the 800 million vaccines that are distributed across the world. Africa has received less than 0.2%. So that is also causing us to start looking at solutions. We can't always be at being a recipient or the receiving end. So for example, the African Vaccine Manufacturing Conference and Africa CDC and African Union are really pushing for a new public health order to ensure that Africans are going to have the tools and the technologies they need to really fend for themselves. So, so this push for change has given me hope for young leaders, particularly young African leaders, to really build momentum for this new public health order that we're seeking and really commit to being part of the solution. There is a role young leaders can play in this complex dynamics of global health architecture. And I know sometimes it can be overwhelming, but hopefully if you've learned something during this pandemic, is that your voice matters. So really speak up when you see something wrong, whether it is a panel of all white or all male leaders, from wealthy nations speaking for countries around the world, or whenever you see inequity in your own surroundings, please speak up. Make a commitment very early in your career that you will not stand for injustice anywhere in any form. And I'll tell you from my personal experience, it's not easy to do that. There are forces that will work against you, especially for young women, especially on the era of social media. It is very easy to get shamed. It is very easy to get pressured from family, from friends, when you start talking about issues that are not popular, that are not, when your views are not in the majority. But please use your voice, please speak up. Frankly, you are the ones that we've been waiting for.
Thank you, Professor Senait. It's exciting to note that even with the pandemic, we have more opportunities for the young people. We are looking more inwardly for solutions. That means there is more space for the young leaders to sprout, to grow, and to be agents of change. And for our contributions generally to be seen, and also we have space to add a brick in the global health sector. Edith, what do you think about this?
Interesting. Wow. I think each time you're explaining, I'm sort of getting so glued into, the discussions that I wish it could go on and on. So you're right. It's often young people that actually bring change. And this change really will require efforts from young people, including everybody else that's, on this platform, or the other community members on this platform, to commit towards providing solutions. And speaking of, changes in systems, health systems. So as a result of COVID-19, we have seen many shifts in health systems and a global focus on health equity and greater realization of the importance of building the capacity of local health systems. So we see that this time has also brought up long-standing questions in the sector about decolonizing global health. And there are lots of interpretations and ideas behind these efforts and dialogues, though. And so my question would be, in your opinion, what does decolonizing the global health sector mean? And how can individuals be part of this effort to enact a power shift in global health and international development?
Thank you, Edith. That is, I think, a question that we all are grappling with right now, including, not just people from the global south, but from global north, people who are committed to justice and inclusion and diversity and equity and hearing all voices. So for me, it's one thing to talk about these things, but frankly, it's not just enough to just call for change, right? This must be actually followed with action. If I give you an example, for example, this year's Global Health 50/50 report showed that there is about 25% annual turnover in global health leaders. And yet, there is no significant change in the demographics of leaders. So it's not like these positions are not available, right? But when one person goes out, who comes in to take that position is a person of the same demography. So I think we have a lot to do. What does that mean? That means, action isn't being taken at the highest levels, right? We can talk about making change, we can talk about decolonizing, but if those calls for action are not actually followed by implementation, we're not going to see change. But I feel like all of us, individuals can join the movement of decolonizing global health. I don't think this is something that should be left only to those who are in power. You remember earlier I talked about our voices and the voices of young people. And also, frankly, all of us need to examine our own identities and privileges and center, the voice, perspective, and needs of people on the ground closest to the work. It's also like, one of the things that bothers me the most is this notion of classifying global health as charity, to those people over there, right? Like, so really like getting rid of this them against us is going to get us a lot farther than where we are now. There is immense privilege to be removed from the problem you're trying to solve. It has consequences as well. We have blind spots. We tend to come up with oversimplified solutions to very, very complex problems. So I think one of the things, that we need really to do is empowering people that are closest to the problems, who actually know the solutions, have the power and the voice and the resources they need to be able to effectuate change. But these things don't happen, radically, like they don't happen drastically. In order for one person to gain power, there are times you can share those powers, but other times it means to give up, right? So really knowing when to lean out and pass the mic, but at the same time, really being very unapologetic advocate for things that really matter to you. And I will really leave you with a quote from, Audre Lorde, right? Nobody in the world, that is nobody in history, has ever gotten their freedom by appealing to the moral sense of the people who are oppressing them. So figuring out a way to really fight for the space and using our voice, using our privilege, but also it's not only a difference of color. Even people from the global south, we see this often. Only a select few that are favored tend to get the seats and stay in those seats. So being able to know when to pass the mic, being able to know when to lift others, and being able to know to give up our seats so that others can come and take our seats is what we really have to practice as individuals.
Awesome. And as you're speaking, I think what first came to my mind was one of my favorite quotes, and I think you did talk about this in the Women's Leaders Conference, and you say, don't rely on the most powerful to make change. So basically, it's everybody's effort, it's everyone's efforts, commitment, and especially as young leaders, I believe we need to, stand up for ourselves and use our voices indeed to fight some of these challenges in global health. So thank you very much, Professor Senait, for your response. And so we're just going to pause here and see if we have any questions from the community. Please feel free to share your thoughts and questions in the chat box, or raise your hand, or just come off mute at this point. Thank you.
Thanks so much, Professor Senait. Thank you, Precious and Edith. We have a number of questions in the chat box from the community. This has been so rich of a discussion so far, and so I can't wait to get these questions in as well. So we have a couple already in that I'm just going to start with. I'm actually going to ask Omar to come off mute and share his question. So Omar, if you wouldn't mind asking your question to the group. Let's see, might be having some trouble, so I'm happy to just read it out, no problem. So Omar asked, how do you deal with some of the work politics? From your experience, what have you found works best when it comes to dealing with powerful people? So something you just talked about the different positions and that democratization of participation, but how do you deal with it when it comes into the day-to-day dynamics? So within your team or organization, how do you actively push different agendas from your own?
Thank you, Omar, for that question. I mean, I think workplace politics is there no matter what you do. I oftentimes tell myself, showing up as my authentic self is the best I can do, and not get dragged down and not try to align and, sort of present and do my level best. And then frankly, keeping the interest of not just myself, but the communities I'm trying to serve. So, people talk about, keeping your eyes on the prize, but you will see that, it gets harder and harder as you climb up in any work environment, especially for people of color. There is an expectation that, when you're a person of color, that you show up and you're expected to be 10 times as good, not average. I mean, I always joke around in medical school that the expectation, there is, deeply entrenched structural racism, sexism, whether if you're a woman, and if you're a woman and a person of color, it's even double trouble, right? So politics is going to be there, whether it is somebody having a different agenda from yours or someone having a different expectation set out for you compared to what you think yours is. But I think one of the things you want to cultivate, as a young person growing in this field, is that how do you present to your authentic self? How do you not get bogged down by the politics and really keep your eyes and your efforts focused on the work? And also, how do you cultivate mentors? How do you cultivate and seek out people who can share their experiences, who will allow you to lean on? When I look back at my life, at every encounter, I have been very fortunate to find people who've made their hindsight my foresight, helping me minimize the landmines, helping me stay focused, helping me navigate the complexities, because politics is going to be there no matter whether you are high or low in a position. So really it is sort of up to you to try and figure out how do you, present yourself? How are you true to yourself? How do you lean on others? And then how do you stay focused despite all the distraction on the work, on serving and frankly serving your communities? So that would be my advice. And I will also comment, I think earlier I shared one of my two favorite authors, writers, activists are Audre Lorde and Assata Shakur. And I gave you Assata Shakur's quote and mentioned Audre Lorde, but those two really sort of are, their writings and their work is food to my soul. So if you have not looked into their work and their writing, I highly encourage you to do so.
Thank you so much, Professor Senait. One piece that you brought out in that question around really cultivating mentorship. And so I'd love, even to pass it to Precious and Edith too, and thinking about your young leaders as well, everyone on this call, part of our community, and some of your thoughts on that about cultivating leadership and addressing some of the office politics. Do you have anything you'd like to add before we get to our next question?
Okay, I'll go first. Thank you so much, Hannah. And thank you, Professor Senait, for sharing that. I'm definitely learning from you as well. Like Professor Senait said, there'll definitely be rubbing shoulders here and there, not necessarily in your office spaces, but even in the spaces in which we have to do our implementations. I'll give an example. I'm an advocate. My role is advocacy, and oftentimes you have to interact with different stakeholders, each with a varying opinion, and it's very important to you often engage and understand where the person is coming from, their perspective, and use that to also make a point. At the end of the day, in advocacy, what we learn is you do not necessarily have to push somebody down or bash them down, but rather offer an alternative or make arguments and have evidence to support why you intend to do certain things a certain way. We've also learned that even through advocacy, we've also learned that sometimes you actually need to get the person on the opposing side to your side by buying them in, by getting them to understand the cause for which you stand, the reasons for which you're doing the work that you're doing, so you become a team other than working on opposite sides. That has worked for us. It has worked for me in advocacy especially, and I think it could work for you as well. Over to you, Edith.
Thank you very much, Precious, and thank you, Dr. Senait, for the insight. I think just to add a little bit more from what Precious has indicated and said is, I think part of my experience really has also been having to embrace diversity. And by that, I mean having to understand that we all have different perspectives, we come from different backgrounds, and what's important is really standing on what you believe in and making everybody else understand, or whoever you're having this discussion with, make them understand that this is what you are advocating for, this is what you're standing for. So for instance, if it's in a strengthening health system, as we're discussing on this chat, it's about making it clear that this is what I choose to stand on as Edith or as Precious, and move with that. And I also love the fact that you've indicated how mentorship becomes a key, something very important and critical in this journey. And I think I'm one of the people that would love, continued mentorship. Being on the GHC or being part of the GHC has been a great, opportunity for me, and I've learned so much already, but I believe there's still more that needs to be done. And I still need to do more as well as an individual in terms of the mentorship, in terms of engaging with different, individuals that stand and believe in, advocating for what is right. Thank you.
Thanks so much. I want to make sure we get to some of our other questions. I'm actually going to ask Sandra, if you wouldn't mind coming off mute and sharing your question.
Hello, can you hear me?
Yes, we can.
Hi, salam, Dr. Senait. I have a question about COVID and the artificial restrictions that I see coming into force in the future. Can everyone hear me?
Yes.
So in the beginning, when we all started projecting into the future about how COVID was going to destroy, I guess, low middle income countries because we had bad health systems and it was going to be an Armageddon, and it didn't really end up like that. Now, before I make broad sweeping statements, India's having a really bad time right now, and we really don't know where this is going to go. However, to me, it just looks like it's the artificial changes or the man-made changes or the response, which is actually going to disadvantage people in the global south. The main thing being vaccinations. So now everyone's moving towards, at least in the global north, vaccinating their populations and looking at how they can reopen up by having either quickly testing people, testing and tracing, having vaccine passports, quote unquote, and that sort of thing. If it goes to where I think it's going, where there's going to be massive restriction in terms of accessing international travel or various services for people who are not vaccinated or can't prove easily whether they have COVID or not, what kind of advocacy do you think we can get involved in to prevent something like this from happening?
Thank you, Sandra. And I 100% agree with you. Of course, we're not out of the woods yet, but we have at least thus far, especially for really LMIC countries, have managed the COVID pandemic in ways that has not been anticipated, right? I mean, the writing was that people were going to die at highest levels. You remember the prediction from many leaders in the global north, sort of forecasting what was going to happen, especially in sub-Saharan Africa. We didn't see that for a number of reasons. One, we are used to outbreaks. We deal with measles and Ebola and Lassa fever, so the systems are in place, even if they're not perfect. We're used to identifying infections and treating them and preventing them and contact tracing and isolation. The public health measures are in place despite their shortcomings. African leaders in a remarkable way also came together really fast and put measures in place, and some at the cost of their economies, right? I mean, a country like Rwanda had to make decision between lives and livelihoods, so those drastic measures that were put in place with the lockdowns are costing their economies. But this is a country that has just 25 years ago have emerged out of a genocide and has enormous value for human life. So, we have seen across many African countries this pandemic being managed very, very well. But I couldn't agree more that the man-made or human-imposed inequities are the ones that are now facing. Yes, I mean, countries like Brazil and India, despite being middle income, have had difficulty for a number of reasons, but the countries that have failed in managing this pandemic are ones that don't have public health measures, like the United States, but also had populist leaders, right, who are not willing to acknowledge, whether it is Brazil or the United States, and even in India, when you see what was happening around election rallies. And this is kind of a failure of leaders to follow basic public health measures that has resulted in uncontrolled, and then I'm going through this same issue as my own country of origin, Ethiopia. But when you look at what is sort of the next phase, right now, United States has made vaccines available for anyone 16 and above with less than 5 miles radius, and has a stock of over 300 million vaccines in case we need a booster dose, while people in Africa cannot access vaccines until 2023. And these are people, vulnerable population, elderly, frontline workers. And as if that is not enough, when you juxtapose a requirement for vaccine passport or the ability to produce a proof of being COVID-free as a condition for movement, it is going to be double inequity, right? It's going to disproportionately again impact people who've already been most vulnerable. So these conversations are in place. UK, for example, had put some restriction even for travel within the UK. But I don't think we have to wait until countries mandate a travel passport. I think the advocacy, frankly, starts now, right? Like they say, an ounce of, prevention is worth a pound of cure. So I think if we can get, groups like Global Health Corps that have incredibly strong and passionate young people who have platform through social media and through their social networks have to start speaking up, and not only just speaking up, but holding groups accountable. I think one opportunity, for example, the WHO has been asked by many countries, developed nations, to put together a travel passport, and WHO has pushed against that. So how do we mobilize and organize ourselves within countries, across borders, to push on this double inequity that is going to disproportionately harm those that are already in harm's way? Shouldn't wait till the policies are imposed. So I would say, honestly, start social media campaign, use change.org, reach out to your friends, start WhatsApp groups, tag leaders, whether it's Biden and Harris administration, or whether it is Boris Johnson, Macron, the leaders of the multilateral entities. Ask your own leaders to speak up. The burden should not be on only us speaking up, but demanding our leaders speak up and push this, especially in the multilateral forums where these heads of states come together, oftentimes for ceremonial things. So I really appreciate you, Sandra, for raising this issue, but I think we cannot underestimate our voices when it comes to pushing back against policies that are going to disproportionately harm populations that are already harmed. I will stop there.
Thank you so much, Professor Senait. We actually have a couple other questions that are themed around COVID, which I'll just kind of group together. One really being on how to improve the capacity of Africa to be able to produce and really fight future pandemics. I think you've touched on this a little bit. So this question from John Wilson, one of our alums, and how Africa specifically can enhance that capacity. And then another from Dennis, really looking at how we're addressing this amidst budget cuts and some realities of funding that have impacted health systems throughout the COVID era. So I think these looking at health systems, and I know Precious and Edith also are very interested in the health system side. So I'll kind of pose those questions to all of you.
Do you want me to start, or Edith and Precious, do you want to?
Absolutely. Jump in and then we'll
happy to start, and then I also would love to hear from Edith and Precious about their perspectives. I think I probably will start with the second question, how do we strengthen health system in light of budget cut? And that is a real crisis, right? I mean, unfortunately, the economic impact of this pandemic is felt across the world. And although we talk about, global solidarity and unity, at the end of the day, what we've seen with this pandemic is countries are fending for themselves. And sadly, in the face of this, pandemic and economic crisis and, disproportionate massive demand on the health systems that are already weak, we're now seeing significant budget cut from DFID restructuring itself to many donors cutting budgets given the economic uncertainty and other things that are impacting their bottom lines. So for me, that is sort of the reality. So the question is, how do we deal with this? How do we take the resources we have and maximize outcome? And because you've raised health system questions, and I think one of the calls, Dr. Tedros always talk about quality over quantity. I understand the need to cut budget, but when you cut budget, allow program flexibility, right? One of the biggest detriment in the global South, and we all are, donors guilty of this, is that, we come with our specific agenda and we create all these vertical programs, as if people's lives live in silos. So what we see is a very weakened and paralleled health system that does not have service integration. So hopefully we'll emerge out of this pandemic, even if there is budget cut, there will be quality in programming, allowing countries and allowing partners to program in a very integrated way. So if I give you an example, we fund nothing but sexual and reproductive health. There is no ifs and buts, and we're not apologetic about that. There are very few donors who put their resources for safe abortion. However, that does not mean that we don't look at systems, right? So as part of our strategic shift, we are now working with government and supporting health systems work, strengthening from workforce to health informatics to commodities, but we want to see abortion and family planning and other adolescent SRH programming being integral and part of the basic primary healthcare system. And frankly, the burden also lies on countries, right? There needs to be leadership to demand, to say to donors that, women and men and children, young people don't live their lives in silos. So to expect a woman to show up at one facility that is funded by PEPFAR for HIV and go somewhere else for abortion that is funded by me, and in a different place to seek malaria care because that's where Global Fund puts the money, is unconscionable. But I think that is going to require advocacy. That is where Global Health Core Fellows can play a very strong role. Like I've said, don't underestimate your voice. But I think despite the growing resources, countries should push for an integrated health system that put basic primary healthcare accessible at the community level and not silo and verticalized programs. In terms of vaccine manufacturing for Africa, I could not agree more. I think this is the moment. Of course, the mRNA technology lends itself for a rapid build-up manufacturing capacity. Corporate greed in pharma is part of the tapestry. So it is a fight to have IP and what have you. But right now, Africa is fighting to be much like the Serum Institute of India. We're not asking for IP or TRIPS, but what we're asking is for tech transfer. There is incredible opportunity and momentum and leadership. So countries like Rwanda, South Africa, and Senegal are positioning themselves and frankly, not produce necessarily to export, but just really to export for the continent. Rwanda seeks to set up mRNA manufacturing capacity that will produce COVID vaccines now. But as you say, down the road, we can then produce vaccines for measles and malaria and other things that the continent needs. Right now, we produce only 1% of the vaccines we need. 99% of it is imported. So when we rely in a broken system like this, where every drug, every therapeutics and diagnostics that we need and vaccine we need is imported, and you have a disruption like COVID, we are left out there on our own. So there is incredible leadership from President Ramaphosa, President Kagame, Macky Sall, and others, African Union, to really start producing. And I'm really optimistic if we continue to push and ask donors, to sort of, instead of, what do they say? You either teach a person to fish and, feed them for a lifetime or give them fish for the day. Instead of dropping us 10,000 and 15,000 vaccines here and there, setting up the ability to manufacture vaccines, frankly, is going to be the most equitable way to deal with vaccine apartheid that we're seeing right now.
Thank you so much, Professor Senait. I'll just speak on from the part where you're talking about health system strengthening. And I just want to say that we are now living what you just described regarding strengthening the health system as a whole, and also strengthening the community system in order to respond to the health needs of individuals at community level. So we are moving, there's a big shift led by the government from vertical to horizontal implementations, where you find one program is being layered with another. So you find we are moving towards buckets of services other than having malaria, HIV, contraception alone. We are moving towards implementing them as a whole. And when you talk about when the question around defunding, and earlier on in the conversation, Professor, you mentioned that during the COVID-19 period, there was a significant spike in using telemedicine and somewhat self-care. And just to mention that Uganda is one of those countries that is leading in the development of the national self-care guidelines for sexual and reproductive health. And we think that scaling up self-care interventions will in one way improve the health system efficiency, but also reduce on the burden that the health system is currently carrying. So I see countries, I'll speak for Uganda, taking some bold steps towards strengthening the health system by strengthening the community health system, the primary health care front, and also adopting new age technology and interventions such as self-care to improve the health system, but also the health response as a whole.
This has been such an exceptional conversation and so wonderful to have you, Professor Senait, Precious, and Edith join us. I am so sorry that we don't have more time. That's always the sad part of these, to be able to hear more on each of these conversations, more from you, Professor Senait. I know we had a few questions that we didn't get to, but really appreciate everyone joining us today, everyone on the line who has come and listened to this. I hope you are leaving feeling inspired and with some calls to action. Things I heard were definitely focusing in on the community, the commitment, I heard you say it over and over again, Professor Senait, the commitment to equity. And again, really asking ourselves that question, how are my actions advancing equity in everything that we are doing? So I want to extend such gratitude to the three of you for joining us today, Precious, Edith, and Professor Senait. Thank you for your time and your insights with the community, and thank you everyone who has joined. Wishing you all a wonderful and healthy day, and Thanks so much for being with us. Take care, everyone.
Thank you. Thank you.
Thank you. Thank you so much, Hannah.
Thank you, Professor Senait.
Senait.
Thank you.
Thank you.